Hello and welcome. You're watching Frontline. Now, on this episode, we give a special focus to oral and dental health and how much seriousness you need to give your oral health. Tongue piercing has lately become more and more popular, especially among the young people. However cool it may appear, it is important to note that this type of body piercing can be very dangerous to your oral health, and we'll be telling you how and why. And did you know that having bad breath could be a condition? It's known as halitosis, an oral health problem where the main symptom is bad breath. In most cases, finding the cause of the bad breath is the first step towards treating this preventable condition. On this 30 minutes show, we'll have practical demonstrations of checking your dental health, home remedies, and also understand more about mouth cancer. Joining me to have this discussion is Dr. Jacinta Monday, doctor in charge of DentMind Garden City Mall. Dr. Jacinta, thank you for creating time. What kind of constant problems are brought to your table every day?
Okay, so most of the common problems that we actually experience in the clinic are bad breath, or rather what we call halitosis in our language, and also dental caries, which is decay and pain. Those three, yes. So when patients come, most of them will be like, oh, doctor, I've had bad breath for a long time and I would like that sorted out. Yes.
Dr. Jacinta, we did a spot check on Kenyans and asked them about bad breath and oral hygiene, and this is what they had to say. Let's take a look.
Wanafahamu kweli kwamba wako nayo?
I think wengine hawajui, juu wangekuwa wamejua, wangekuwa wametake action.
They will still talk confidently, but you who's listening, you're the one who is going to feel it or smell it maybe.
Most of the people have the bad breath, and some of them knows, but they can't. They try to find the way to find whether they can stop that bad breath.
They have that confidence when interacting with people, unless you are the one who notices that they're having that bad breath.
What do you think they should do to correct it?
So wanafaa to maintain just personal hygiene, like brushing teeth.
Regular brushing of teeth after every meal.
Brushing teeth, if you can't, I remember we were told you can gargle your mouth with salty water.
Dr. Monday, you've heard what Kenyans are saying. I think the most constant problem, just like you said earlier, is bad breath. What causes bad breath and what are the remedies and what should you do to avoid bad breath?
So bad breath is caused by many factors. First, it can be because of gum disease, because when you have gum disease, you have your gum are inflamed and they're swollen. You also have a lot of dirt that is attached to your teeth, what we call either plaque and calculus. So you find that you have abnormal bacteria in your mouth, and those bacteria, they release, odors that cause you bad breath, okay? And then the other major cause is cavities. You may have cavities that are actually hidden in between your teeth that you're not able to see. So you need to come for checkup so that your dentist can be able to identify the cause of bad breath. The other cause could be because of impacted wisdoms, especially the wisdoms when they don't come up fully. They're in a position that you're not able to brush very well. So the kind of food that accumulates there, food that has been there for days, that one can also cause you bad breath. The other could be because of, tonsils. When you have inflamed tonsils, they tend to trap food, what we call tonsilloles and all that. So that can also give you a very bad breath because it gets stuck the food gets stuck in your tonsils. And then when it stays there for days, people will be actually able to tell you that you have bad breath. Yet at that time, you actually don't have a cavity. The other one could be because of, diseases of the sinuses and all that, or GIT, But majorly bad breath will be caused by things in the mouth, gum disease and cavities, and something that is hidden that you can't
Dr. Monday, most people, even with bad breath, they realize that they know that they have bad breath. So most of them you'll find they actually take care of the oral hygiene. They brush after every meal, or even brush 3 or twice in a day. 3 or 2 times in a day.
Yes.
Is that not enough?
That is not enough for you to manage your bad breath, because if you have gum disease, if you have the calculus and the dirt, the dentist actually has to clean that out. So that is that you can't remove with your toothbrush. That's why we say for general cleaning or rather scaling, you have to come at least twice after every 6 months. Come for cleaning so that the dentist can be able to remove that kind of dirt. Again, if you have cavities, they have to be filled, because once you have a cavity, you have actually food that is stuck in between your teeth or just inside the cavity that is actually decaying. So you need that to be cleaned out and you need to be filled. So cleaning and brushing at home is not enough for you to manage your bad breath. Yes.
Many might say that, we have seen adverts of mouthwash, and they say you can use a mouthwash, it will penetrate to where your toothbrush cannot penetrate.
Yes.
Then
those are just additives, the dentist is the one to give you the definitive treatment for your bad breath. Yes.
Twice a year, most Kenyans relate people who go to the dentist as a bit well up.
Oh,
but how much will it cost one to visit a dentist, at least for cleaning at least?
Okay. It depends on many things, the dentist, the location and all that. But basically with 5,000 Kenya shillings, you should be able to get cleaning that is done, full mouth on all the teeth. Thorough cleaning from the dentist with 5,000 Kenya shillings, and that is little money considering you're actually saving over 6 months. Yeah.
I can see you have a model of how the mouth looks like.
Yes.
So after you come once, the other 6 months in between before you visit Dr. Monday again, how should you brush your teeth? Because most people do not know that.
That is a very important question, and I like it very much because effects of bad brushing habits are very, very bad, and they are detrimental to your teeth. So when you're brushing, we want you to brush in a rather circular motion rather than horizontal. We want you to hold your toothbrush in an angulation of around 45 degrees close to your gums, and we want you to do a circular motion, okay? Because once you do horizontal motion, you end up cutting the gum, and then you also expose the tooth. Sometimes you end up cutting the tooth, and with time you start getting some bit of sensitivity around the teeth, because once you cut the tooth, you're exposing the living part of the tooth. So with that, you find that especially the elderly, from the age of 40, 50, you find that someone has actually cut their teeth, and they are very sensitive because you start getting grooves around the gum, what you call cervical abrasions. So your brushing motion is very, very important. These effects take time, so it's good, hold your toothbrush at around 45 degrees, do in circular motions, circular, small circles. Brush on all the surfaces. On top you can do horizontal. Remember also to do inside your teeth, all the surfaces, okay? Don't forget the molars, do on all the teeth, because the moment you forget the back teeth, you start getting cavities. And you have to brush for like more than 2 minutes, 2 to 3 minutes, in the morning before breakfast and at night before you go to bed. Yes.
What about the tongue? I hear the tongue holds a lot of
bacteria. The tongue has to be cleaned. Yes. You have to clean the tongue. You have to, because the tongue itself, the anatomy of the tongue, or rather how the tongue is made, it can easily trap that for long, so you have to brush in the morning and in the evening.
That's how you're supposed to brush?
Yes, just
again in a circular motion.
Yeah, this one really doesn't have a motion per se, but just circular motion makes sure that you're able to remove all the dirt. Yes.
There are people who say that when I start brushing my tongue, trying to clean, I feel like puking.
Yeah, that is something we call a gag reflex. It's I think it's more to do with a person, okay? So once you're brushing, just concentrate on your breathing. Make sure you're breathing through the nose. Don't concentrate on the tongue, or rather the mouth, because you're going to get something you're going to get a reflex, or rather something that you can't control that makes you want to puke. So it's something that you can control with your breathing, and don't concentrate more on the tongue. Yes.
And how about the type of toothbrush? Does it matter? Because we see some toothbrushes with a tongue cleaner at the back.
Yes, it does matter. You need to get something that is soft, okay? And you also need to get something that is going to clean very gently on all your teeth. You really don't have to get the most expensive toothbrush in the supermarket, but I think in the Kenyan markets, a toothbrush worth 100 bob that's a good toothbrush. Okay, the number of bristles, they have to be like a lot, and also it has to be very soft. Don't use something that is very harsh. Don't use something that is over soft. Okay, because for those ones that are really soft, we usually recommend for people with active gum disease, okay, so that they're not able to cause injury to their gums. Yes.
There's another question. Are you supposed to brush immediately you wake up before breakfast or after breakfast?
You're supposed to brush before breakfast.
Before breakfast?
Yes.
Then you take your breakfast and leave?
Yes, because of the structure of the gum. Ideally, once you eat, your gum becomes, it becomes a little bit it's like exposed, okay?
Yes.
So once you eat and then you brush it, like, you'll cause a little bit of trauma to your gum. So in the morning, very early before you eat, just brush your teeth, take your breakfast, go. In the evening before you sleep, brush and sleep.
There are people who do not trust toothpaste that contains fluoride, so they will use coal, they will use salt.
Yes.
What are the myths and misconceptions surrounding that?
People with fluorosis, we do not recommend them to use a toothpaste that already have fluoride. Fluorosis is that staining of teeth. That,
like you have brown teeth.
Yeah, you have brown teeth because of taking salty water. So with fluorosis, you already have a lot of fluoride in your teeth and in your system. So we recommend them to take toothpaste, or rather to use toothpaste that doesn't have fluoride, so that you don't increase the amount of fluoride already in your body. Okay, then for a normal person, you have to use a toothpaste that has fluoride. Okay, for children below 2 years, we recommend that they use toothpaste without fluoride. So
why is that?
Because we want to regulate, because they can easily swallow,
Okay.
If you swallow toothpaste and you're a child that has fluoride, it means you're giving you more.
Alternatively, those people who use coal and they use salt or salty water,
Yeah.
how safe are they?
I don't think charcoal has any side effects per se, but it may not give you the best results that you have. I will also not say that it's very effective. If you really want your teeth to be just brighter, visit the dentist, get your whitening done, because you'll use charcoal for so long and it may not really give you the best results.
Discolored teeth are a major concern to people. How's that process of whitening the teeth? How's the process like? Is it a surgical process?
Yeah.
It is?
No, it's not surgical. When you're whitening, we usually use whitening kits and rather gels. They are chemicals that are made specifically for whitening. Okay, you can do two methods of whitening. You can do it from home or from the clinic. If you do it from home, we usually give you a concentration that is a bit lower, and we make for you the tray that you're able to put the gel inside, and you're able to do that from home. In the clinic, we usually use a very higher concentration so that you're able to get your results faster. Yeah, but it is basically chemicals that you need to highly protect from the gum, from your tongue, and from your cheeks. So once you're doing that kind of whitening, we have to really protect your gum and your tongue.
Can one's dental formula affect their oral dental hygiene?
Yes,
How so?
because you find that for people who don't have a good dental formula, they're not able to brush very well around all the teeth. When you find like someone has teeth that are crooked, or rather teeth that are just not very in line, you're not able to go really well in between the teeth, or rather you're not, like for the normal brushing, you're not able to achieve that. So you find that you're easily getting cavities, you're easily getting gum disease, compared to someone whose teeth are just very much straight. That's why we recommend you to get alignment early. Once you realize that your teeth are not straight, get alignment. Nowadays, even doing braces for adults. Yeah, so it's good to have your teeth really well aligned from the word go. Yes.
And talking of dental formulas, if you have a terrible dental formula, can that be attributed to your genes?
Yes.
Yeah.
Actually, most cases you will find
it's
that
genetic.
Yeah, it's genetic. It's genetic in a way that your structure, watu fanana, na mkianza kufanana mnafanana almost everywhere. You find that unafanana na watu wenu, macho, height, vitu kaa hizo. So it comes the same to teeth. If your parents maybe have a small jaw, you're likely to have a small jaw. So you find that your teeth are not very much straight because the jaw is not able to accommodate all the teeth, okay? So yeah, it has some bit of genetic variation, yes it does.
And then there are things like veneers that can be used to correct your dental formula.
Yes.
How effective are they, and do they have any side effects, and how's their affordability like?
For side effects, I wouldn't say, you know, you will never get something that is as good as your natural tooth, okay? But really for veneers, especially the permanent ones, they'll be able to serve you for long. When it comes to the side effects, they're just minimal. Maybe sometimes you may get some bit of sensitivity, or after some few years, you know, it might fail. So it will never be as good as your natural tooth, okay? But if it's something that you really need to correct your dental formula or just to make you smile better, then you go for it.
And
Yes.
how long will it take if you take the option of having braces?
Well, it depends really on the case that is being treated. Some cases will take, you know, from 18 months. Others will go even up to 3-4 years. It depends on really what you're correcting. For children, it takes less time because they're still growing and their bone is soft. For adults, it may take longer, really. So there's no time frame.
I understand Dr. Monday is here with her medical equipments, and with the help of Dr. Dorcas, they will demonstrate. Stay tuned. Welcome back. This is Frontline. If you're just joining us, the discussion is on dental and oral health. And joining me to have this discussion is Dr. Jacinta Monday, the doctor in charge of Dent Mind Garden City Mall, and dental assistant Dorcas Wanje. Now, on the other side of studio, my producer Harriet Chimea gets to have a feel of what it's like to visit a dental clinic.
Yes. Hi, Harriet.
What are the procedures?
So once you come to the clinic, we examine you. Before examination, we ask about why exactly you come, so that you're able to, you know, give you exactly what you want, so that you're not treating something different other than what you came for. The other thing that we check is also, you know, your medical issues that might be of interest to us, so that we're able to treat you as a whole person. So the first thing when you come, we'll just examine you, ask you about your medical health, if you're pregnant, because we don't like exposing x-rays to pregnant moms, especially in the first and third trimester, okay? And then after that, we proceed to just look at your teeth, able to pick exactly your concern, so that you're able to treat that, okay? So now, Harriet, you're just going to open your mouth, so that you're going to, examine. Yeah, just open. Yeah. So this is just Harriet. We will be able just to pick a few concerns. First of all, she has some bit of fluorosis, which is just mild staining of the teeth from salty water. Some people are actually okay with living with that. Other people would want their teeth, you know, a little bit whiter. So in that case, we can do for you whitening or veneers, depending on the severity. If fluorosis is very, very severe, we usually do crowns. So yeah, it depends on exactly the chief complaint. If it doesn't bother her, we find we don't manage it. We just let it be like that, okay? The other thing that we can actually identify is that Harriet is an adult and she doesn't have wisdoms. Her wisdoms are just a little bit on top, hazijafika the normal level. So we say that they are impacted, okay? So it means that zimepita iyo age ya kumea, okay? So in that case, what happens is that she'll not be able to brush very well on the wisdom. And with time, cavities there and bad breath, okay? Sometimes you'll have issues with your gum because that food, again, it goes inside your gum and then it causes your gum to swell because of the decay and all that is happening there, okay? So eventually you will have to get your wisdoms removed, okay? It's not an emergency, it's something that you can plan over, because some people know, we tell them, this is an impacted tooth. Most of the time when you take the x-ray, it's not very straight, it's slanted. So we tell you it's not going to be a normal extraction, it's going to be surgical. And surgical means that you're going to open up, because the tooth is not fully out. Going to open up, reduce the bone that is actually overlying on that tooth, and then from there we're able to remove the tooth. So it's not something for you to be. Once your dentist tells you this tooth has to be removed surgically, don't be scared, okay? You will be fine. Yeah, so those are, I think, the major things that we can pick from her teeth. The other one is just a gap on the lower incisors. Some people will be okay with their gap, others will want it to be closed. If you want it to be closed, then we close with braces, okay? Yeah, so when you come, we check up, we give you the treatment plan. The treatment plan means that we are going to first start with your chief complaint. What exactly brought you to the dentist, okay? And now that when you're able to pick other issues that need to be sorted, now those ones we give you a breakdown of how you're going to be treated and how you're going to manage that. For cleaning, you have to be cleaned, you know, your teeth look clean, okay? But you need cleaning. You need cleaning after every 6 months. Reason, we want to maintain them at that, you know, the way they are. We don't want you to get gum disease. We don't want you to start having bad breath, okay? So cleaning has to be done after every 6 months. Come for checkup, and yeah. So basically, we examine you and give you a treatment.
Dr. Monday, you had earlier mentioned of you may not treat a patient on her first trimester of pregnancy.
Yes.
But what happens if the patient really needs that treatment? They're in dire condition and they need that treatment, and they're in their first trimester of pregnancy. And what are the repercussions?
So for pregnant mothers, I have not said that you're not going to treat them. What I've said is that it's not safe to expose them to X-rays in the first trimester and also in the third trimester. It's because at that time the body, or rather the organs of the infant, they are developing very fast, okay? So at that time we try as much as possible to avoid exposing X-rays. With modern technology, we're still able to treat them. If it's root canals, you're able to do root canals without necessarily having to expose them to X-rays. We have machines that are called apex locators that you can safely use for a pregnant mother, and you're able to do a successful root canal for them, okay? So we treat pregnant mothers, only that we treat them with care and caution so that you're not able to harm the baby, okay? Yes, so we do treat them.
Dr. Monday, piercings in the mouth, the tongue, and around the gum, it's a popular thing among the youth. Yes. Harriet had mentioned to me some time back that she had a piercing, then she got rid of it. I can see her laughing sheepishly right there. But what are the side effects of having these piercings? They seem fashionable, but do they have side effects?
I wouldn't say that have side effects per se. But once you have a piercing, you need to make sure that you're cleaning very well around that piercing, okay? Another thing that you have to take caution is, how is it done? Where is it done, you know? Because if it's done in a place that's not sterile, you may get infections from there. So you have to be very, very cautious on, you know, where you get your piercing from, and after it, are you really taking good care of it? Because if you don't brush around it very well, you will get food trapped there and you'll start getting inflammation of the tongue and all that. So really, you need to just make sure that piercing is, you know, good, and it's, even the metal that they use, just make sure it's good quality. I wouldn't say don't get piercing, but I would say if you're getting it, where is it being done? What exactly are you putting in your body? Is it clean? You know, such concerns. Yeah.
Dr. Monday, please tell us something about oral cancer.
Oh, interesting. Oral cancer is, that's a very sensitive topic, but we have to talk about it, okay? Because people get oral cancer and then they don't give it much concern, you know, because of the lack of awareness of oral cancer. And it's very common, and the thing with oral cancer is that it starts as, there are different types, but the most common starts as an ulcer, what we call squamous cell carcinoma. It starts as a small ulcer that's painful and it's persistent. It persists for more than 2 weeks, okay? So sometimes you get ulcers and then they just disappear on their own. But for cancer, it doesn't disappear, okay? And it's usually painful, and most of the time you find that it bleeds, okay? And and it doesn't stop. It just keeps growing. It keeps growing. It keeps growing. And the reason that most people don't show up to the hospital is because it has myths. It's associated with some myths. You know, some people will tell you it's because you were cursed. That's why you have that wound that is not healing. And then people will start looking for very crazy methods of treating that ulcer. They'll find they're going to the witch doctors, they're going to those herbal healers. So by the time they come to the hospital, it's a bit late, okay? So most of the people with cancer, you'll see them when it's advanced. It could go stage 3, stage 4, okay? So I think it's a matter of awareness. Any type of wound in your mouth that is taking more than 2 weeks to heal, you need to come to the dentist, or rather you just go to the hospital. Once you go to the hospital, they usually do what you call a biopsy of that wound, okay? And they're able to take it to the lab and it comes back with the results, okay? Most of the time, for some cancers, or rather for some wounds, it may not be really cancer. It may just be something what we call benign. But for a wound that is really painful, most of the time we find that it's cancer, okay? So there are stages of cancer. There's stage 1 up to stage 4. Now in stage 1 and 2, we can safely treat that cancer, okay? By what we just call just doing a surgery and cutting all the, the areas that are affected, and actually having also a safe margin, or rather cutting more than we need, so that you're able to ensure that it's out completely, okay? For stage 1 and 2. For stage 3 and 4, it's a bit, a bit advanced. So it's good to just come early, don't shy away. Some of the factors that will make you get cancer is mostly smoking, okay? And, genetics, okay? And also sun exposure, especially for lip cancer, okay? So you need to come early, come get checked. These things, you get tested early, you get treated, and the results are amazing. So don't shy away. Yeah.
Don't shy away.
Yes.
Thank you so much, Dr. Jacinta Monday, doctor in charge of Dent Mind Station at Garden City Mall, for creating time. They say prevention is better than cure. My name is Lincoln Ombogo. My producers have been Daniel Karaoke and Harry Chimer. We'll leave you with his expert view on how to differentiate between having a flu and having COVID-19. Till next week, same time, right here on Frontline. Enjoy the rest of your viewing.
So the flu is very common, especially in this season, and usually the symptoms are fever, headache, muscle ache, but also upper respiratory symptoms such as sneezing and coughing. For COVID-19, it's the same symptom basically, but in addition we have specific symptoms such as anosmia, which is a lack of smell, and ageusia, which is a lack of taste.